Mommy Makeovers. What's the buzz behind it and the safety? So welcome to Rohrichknose podcast, helping you become a better and more informed you. Well, today we're going to talk about the Mega Mommy Makeover. And I'm privileged to have one of my great partners, Dr. Sam Jejurikar, as my guest. He's a board-certified plastic surgeon. And the most important thing is, not only is he a great friend, but he's a Go Blue fan, and we both went to the University of Michigan. But nothing like Dr. Jejurikar, who I think undergraduate medical school residency training. I just did plastic surgery. So I'll just give you a little story. I went to Michigan years ago, and I was going back up a few years ago to a game, and I said, Sam, could you bring me just a cap or something? The next day, he brings me a box of paraphernalia, including some brand new shoes. I said, okay, I got it. So anyway, welcome, Sam. And also, by the way, he's the president of the Dallas Plastic Surgery Institute, of which I'm a member, and he's amazing. He's got an MBA as well, so he's a rock star plastic surgeon, expert in body contouring and facial contouring as well. And so, Sam, tell us about what is the Mega Mommy Makeover? That's a catchy term.
You know, in the world in which we live in, which is Instagrammable, people come in wanting every procedure under the sun done simultaneously.
Right.
And so Mommy Makeover is the term that sounds really catchy. It sounds like a really nice little thing to do after surgery, but it's important to realize that these are giant operations. So when you see before and after pictures on Instagram, sometimes you don't understand everything that's going into it. So Mega Makeover is a term that many of us have started to adopt, so people realize that when you're getting a tummy tuck and a Brazilian butt lift and liposuction and breast surgery, that there's a lot going into it, and you really need to take a step back and make sure everything's being done safely.
Right. Right. And I think that's very important. Safety is key.
Yeah.
Right.
And you are the pioneer in this. No. You have taught me more, and plastic surgeons more about this more than anything else. You know, you're kind enough to say that I'm the president of Dallas Plastic Surgery Institute, but you're the founding member of Dallas Plastic Surgery Institute, and really one of the pioneers of safety in the world of plastic surgery. And one of the things that you have sort of impressed upon us in our rules at Dallas State Surgery Center is how to do surgery safely. Yep. First thing is how to pick the right candidate. So I can't tell you how often patients will call my office and want to know, what's your BMI cutoff for having surgery? And the bottom line is there's a reason there's a BMI cutoff. A BMI cutoff is done for safety purposes. Right. If you're going to get these big operations, you really want to be optimized. Your BMI has to be less than 30. You want to make sure you don't smoke. You want to make sure that you're nutritionally optimized for this. And as you always tell patients, you want to make sure you go to a board-certified plastic surgeon. And from a patient standpoint, that's the most important thing.
Yeah. And someone that actually is an expert in body contouring, you know, you just can't say, oh, I'm board-certified. That kind of gets you in the ballpark. Doesn't put you on base.
Yeah.
I agree.
And I think that the key thing is these are all things that patients need to do before they even start their journey.
Right.
Then when it comes to plastic surgery, there's some really basic things that a lot of people just don't pay attention to. Now, the key papers on fluid management with body contouring surgery were written by you. So I feel a little strange telling you what they are. No. But you know, the key thing is you want to make sure that there's an optimal amount of fluid being put into a patient. When there's a large volume of liposuction, we use what's called the super wet technique, where basically for every cc of fluid you're taking out, you want to make sure you're putting in about one cc in. But then that the additional fluid management on top of that isn't overhydrating the patient. Can't tell you the number of times we see patients who will get fluid overload or get respiratory problems after these big body contouring operations. And then there's some newer adjuncts in body contouring surgery. Tranexamic acid, which is something that you brought to Dallas State Surgery Center years ago, has really been shown in body contouring to cut down on blood loss, both intravenously and more controversially in the wetting solution that we put in. It can cut down up to a factor of about 80%, which is really important from a safety standpoint.
Yeah, and I think and the fluid's so important, Sam, because what spurred all this on was that people were drowning patients in outpatient surgery centers like, you know, a decade ago, and we had to have some guidelines, some guard posts. Yeah.
Then I think one of the big things, which hopefully patients know about it, you know, patients come in now and they say, I'm afraid to get a Brazilian butt lift. You know, I hear so many bad things about people dying with this operation. And whenever somebody says that to me, I always say, I'm really happy to hear you say that. I'm glad I don't have to tell you about the risks associated with it. but here's how we can do it. We can do it safely. So it's a recommendation of all of our national and international professional societies that we use real-time ultrasound guidance for putting in fat. I don't know how many plastic surgeons are still not doing this. I suspect it's more than half of them. But it's really important that if you're getting this done at the same time as a tummy tuck, or even by itself, that the surgeon's using ultrasound and injecting the fat into the safe plane above the muscle. That way you can do the operation without dying.
Do you really think that only half plastic surgeons are doing that? That's crazy because, it's been an evolution, obviously. We used to do it blindly and stuff, but today, that should almost, I hate to say, it should be at least a practice guideline, don't you think?
It is a practice guideline.
Yeah. For our group it is, I know, but and I know in Florida it's mandated.
It's a law in Florida, but only in the state of Florida.
Yeah.
And it's amazing how many plastic surgeons will freely admit to you that I am not that comfortable using ultrasound.
It's so easy. None of us are experts. Yeah, you taught me. Yeah.
It is very easy, but it's an additional step, and sometimes there's technological aspects so people don't want to do it. But there's no reason not to do it. There's no reason to ever take risks with safety.
I agree. So I think one of the key points is if you're going to have a BBL, make sure your surgeon knows how to use ultrasound and does it.
Absolutely. Yeah. And then venous thromboembolism. The data, historical data would suggest that the risk of getting blood clots can be as low as 0.07% with a tummy tuck to as high as 4%, depending. So there's a wide variability. But I don't know if you've seen it, but basically since 2020, since COVID came around and then the vaccine, it seemed as though the incidence of what we were seeing after body contouring surgery with blood clots has increased.
Right.
Have you noticed that?
Yes, 100%.
Yeah, and most plastic surgeons that you talk to will say the same thing. And so, the way you need to understand this as a patient is if you're getting a body contouring operation, even if you're a classically low-risk patient for getting a blood clot after surgery, it's still a high-risk procedure.
Right.
And so we use a scale of measuring called the Caprini scoring, which is of questionable efficacy with this operation. But it's important that you understand that you need to ambulate after surgery. Most of the patients that are getting these huge operations are getting at least a short-term 24-hour dose of injectable chemoprophylaxis or injectable blood thinners. And if you're in a higher risk category, it's going to be longer.
Yeah, and we do all these at our day surgery center. We do the pneumatics before we warm the patient up. All these things, which are really I think they are the standard of care. And then obviously subjectively based upon what Dr. Jejurikar said is, should you use a prophylactic medication?
Yeah. And so, I think the key thing is if you're a patient and you're getting a Mommy Makeover, which is a very cute, great marketing term, think of it as a Mega Makeover. You're getting a big operation. In addition to planning the downtime and the family support and all that, you need to think about optimizing your own health and then picking a surgeon that's thinking about it as well.
Yeah. So let me ask these questions because this comes up all the time. And in my practice too, they say they come in and they want all these things done. And I'm going, I'm not Merlin. So what do you tell your patients?
I talk to them like they're a member of my family or one of my friends, which is it's not safe to do certain things if you're not a great candidate. We want to keep the surgical length of time less than 6 hours. Why do we say that? It's not arbitrary. It reduces the risk of blood clots. It reduces the risk of hypothermia. It reduces the risk of pneumonia. Yeah. It reduces the risk of surgical infection. And so we talk about the reasons behind that. If they insist on a longer procedure, I'm probably not their surgeon, and because we don't want to do things that are going to take unnecessary risks.
Then I always tell them also, it can be staged. We can wait several months or, we can do it, if you're healthy, it's fine to do it, but you can't have it all done. Like I have a patient that wanted her face, eyes, and her breasts done today, and not an augmentation, but, reduction. It's too much time.
It's a lot, and we understand the convenience factor. It's not as though we're not sympathetic to it, but at the same time, everything that we're doing for patients is not medically necessary. It's all things that we're doing to try to improve the quality of their life, but you don't want to take risks with your life in the same process.
So what are the 3 take-home points for our viewers on when they're seeking to find a plastic surgeon to do these mega makeovers after having their kiddos?
Well, I think the first take-home point is, as a patient, you have to make sure you're optimizing your own health. Your weight needs to be at a BMI less than 30 years. You need to be taking good care of yourself. You need to be nutritionally optimized.
Right.
You need to make sure that all your medical comorbidities are taken care of. Second take-home point is, like you said, you want to go to someone that has experience doing these operations efficiently in a location where they can do it efficiently as well. In some places, they can't do breast surgery, tummy surgery, liposuction in a BBL in 6 hours. Other places they can. And you want to make sure that the surgeon has that ability. And then finally, you want to make sure your surgeon is thinking about things like fluid optimization and injecting fat into the safe plane using the latest in technology. Ultimately, you need to have a conversation with your surgeon about safety because there's so many factors that can go into it.
Great. Wise words from Dr. Sam Jejurikar. Key take-home point. So know before you go, because it's not only, it's an incredibly complicated procedure, but you want it to have incredible safety and a great outcome. So give us your thoughts, give us your comments, and thank you so much for subscribing to Rohrichknose Best.